discrimination, radicalization, equality, and equity in times of COVID pandemics. Jonathan Mann said 4 decades ago said that discrimination related to HIV would kill more than AIDS. Unfortunately, he was not wrong. And in order to put an end with HIV 2030 as a threat to public health in UNAIDS, we have to put an end to inequality. Nothing easy at all. This has to do with the stigma fully related to HIV, makes AIDS to be so difficult to end from the social point of view. This is the axis of this symposium. This is the pillar of this symposium. We have seen this with Bruce's presentation on U equals U. Institutional discrimination and the barriers to put an end. This has to do with the treatment and contention of key population as to the cascade of treatment, and they have to test those who are HIV negative. We see that inequality is a cross-sectional question. And in that regard, we are relating this with COVID-19. In Latin America and the Caribbean, AIDS epidemics is concentrated. So we are saying that this happens among key population of HIV. This is why 2020 and now 2021, key populations have been exposed to different forms of abuse of human rights, violence, etc. And I would like to quickly mention that under the excuse of the quarantine and lockout time management and circulation of people that was strongly seen in 2020, there was an abuse of human rights against people in key populations. There has been institutional violence under the excuse of reducing circulation in the hands of uniformed forces, lack of access to health for people with HIV, antiretrovirals were interrupted because hospitals became exclusive centers for COVID. And because of bad planification, trans people did not have any access to hormones, no access to comorbidities and treatment. And we will see the impact on HIV, but also other diseases because of health, non-transmittable diseases, the impact on cancer, diabetes, and other health issues, not to be able to have access or continue with access to the other services. And of course, this has had a very important social aspect. Many people have lost their job, but also some precarious jobs and sexual work has been pushed to clandestinity, and many sexual workers and trans people were forced to leave their homes, and they have suffered and still suffer a very important food crisis. They have been more exposed to COVID and HIV. It is important to understand that Latin America has, unfortunately, a very important role today. If we have a look at the accumulated cases of COVID positive, we have 20%, a significant amount, total population of the region. And a terrible thing is almost 1.5 million people have died, and this is not over yet. This means a global quota of 32%. The countries in Latin America that are at the top 10 of the most affected countries by the pandemics is Brazil, Peru, Paraguay, Colombia, and Argentina, together with other regions in the planet. Of course, what happens in Latin America and some islands on the Caribbean is there are 21 countries that still have a duplication rate that is quite high today, talking about COVID. More than 50% of the global cases in 2021 come from Latin America and the Caribbean. We see this chart in the previous information, and this chart, which is great, comes from UNAIDS. I want to thank Dr. Alejandro Colau from the economic unit that shared this with us. This is a good illustration. If we have a look at the rich, developed countries, this is the upper band. We see that the forecast and the different scenarios in the future have to do with the fact that by March 2022, the estimates say that they would be able to cover total vaccination in very high percentages, not 100% though, but this is related to put an end to the pandemics if not new, no new versions like Delta keep on appearing. Now, if we have a look at poor countries that depend on COVAX, they manage the donation of vaccines, we can see that the necessary coverage of vaccine to control pandemics would come to our countries by January 2024. As you can see, this is 2 years difference, and this means inequality. We can see a big concern. We see how there's an inflection point as to global sanitary or health condition. Rich countries traditionally have contributed with resources as to fighting against AIDS to the poorer countries by means of different mechanisms like the World Fund, etc. There's an ambivalent case. Many rich countries have put a lot of money onto COVAX vaccines as well as other tools as ACTA for the vaccines. And this has given resources by the World Fund as to C19R initiative. And these accumulate vaccines. On the other hand, they discuss on boosters on vaccines when most of the African countries don't have more than one digit of the percentage of vaccines. And we also have countries in Latin America with very low vaccination rates. So we see that we have this feeling like the Titanic, only those who are in the first class will be saved, and those who are in the tourist class, the poor class, under the flotation, below the flotation line, are the ones who will be more prone to suffer from this crisis and die. The caritative, the investment known as bilateral, multilateral, the impact on the investment may be affected, this caritative investment, because rich countries had to put a lot of money in their borders, within their borders, to respond to crisis. So there is a change as to priorities in the global health. There's a trend that is the preparation for future pandemics and how to respond to the global safety. And this can have to do with AIDS. In a few months, the replenishment of funds for malaria will appear, and how we see global sanitary situation is for these three diseases. There's a very interesting concept in the South African philosophy that is Ubuntu. The idea is everyone for everyone. I exist because others exist. And there's some very negative symptoms related to COVID, where there's this philosophy of everyone for themselves. Since this is a pandemic, until not all the pandemics has been solved in most of the countries and most of the population, this will not be solved anywhere. This is some basic concept. And lastly, the emerging idea of mobility, the vaccination passports, restrictions of getting into countries or certain places if the person has not been vaccinated. This creates a new community of people who have this stigma, and they are discriminated. They are set aside because of the fact that they have not had access to a vaccine. They won't be able to perform certain activities or to travel. So not only are we the NGOs, those who work on international health, those who travel who get together and to work, but there's also some population who travel to countries with restrictions for the crops, for example, of certain products. This will have quite a negative secondary impact. Also, this puts us back on the situation, on the fact that HIV has been discussed for 30 years. This is access to the medicine, access to science, access to, well, this is threatened by intellectual property that is in the hands of a small number of pharmaceutical companies. And this affects the poorest countries, those countries having with quite poor policies, health policies. These countries don't have a present government, a present state that can control the abuse of the private sector. For example, compulsorily enabling or disabling a patent, for example. They penalize the problems of supply and compliance. Many countries are affected because pharmaceutical companies are not providing the vaccines, but they also generate an economic punishment to the companies that are not complying with their promise. Also, the importance that we see as to the fact that public health, it is important to have gratuity, the costs to have access to the services in this case of COVID, AIDS, and HIV are not should be catastrophic. And also, fair price with which countries buy PSR, viral load, different retrovirals, different tools. Also, the transparency of the fair allocation of resources, also those that are distributing all the tools among the poorest countries. So it is very important to think that we need to think about the generation of good or bad vaccines. We should not think about this, but the restriction of those who have been vaccinated with Sputnik, which does not have World Health Organization approval, considering the vaccines for rich countries, this generates different kinds of population. Those who received for countries that are for vaccines that are good for the northern countries, and those who received those countries that received vaccines that are not so good in their view. They're calling to urgently distribute more countries to poorer countries. This is their priority. Now, as to during the pandemics, we have suffered of a very poor health communication and sanitary crisis. This is one of the big lessons learned. And this is a responsibility to the formal communication that has generated panels, those who don't even know about COVID, virology, or molecular biology, or coronavirus. The pandemic has been involved or affected by politics, by political parties, and there's at least 10 countries in Latin America that are having a very important political institutional crisis, and this has to this affected by the complications. Of course, the social networks, somehow they have not been able to cooperate, and we are going through quite an important infodemic together with fake news and the role of the traditional media. There are some very persistent anti-vaccine movement, and this even involves anti-mask movements, anti-maskers. This is making a big damage, difficult to revert. Post-pandemics narrative, some countries in the north are thinking what to do when the COVID is ending, and many countries are too far in the south thinking how to overcome the crisis. All this involved with the bad communication, anti-vaccine infodemics, affects the acceptability of the vaccines. This is why we should insist on the fact that the most important aspect in this crisis is the vaccines. We should think that crisis will end before the real end comes, because we will make the wrong decisions. And if we cannot solve this, pandemics will not end. Just to end, I would like to think about some challenges. We have to vaccinate the rest of the world and see how we continue with those countries that have vaccinated a lot. Think about the health structures that have been affected by COVID, mitigate the impact, missed opportunities, dramatically improve communication, discuss the vaccination passports and the restrictions to travels, prioritize the social, economic, and mental health protection in the countries that were affected for 2 years with this COVID situation, and return protagonism to integral health. Just to put an end, people with HIV, they belong to the vulnerable population groups. We have to review this because there's no consensus. We have to prioritize the vaccination, and the access to HIV services should not be vulnerable, and we should not, the people with HIV should not set aside their confidentiality. Some countries have an increase of 25% of lethal characteristics. Decision makers have to know that people with HIV die more of COVID than those with HIV. Vaccinating right now has to be the first priority. And just to put an end, we want to invite you to contribute to two initiatives in Spanish: COVID VIH and COVID and Key. And I want to thank Virology Education to invite us to reflect on this one once again. Thank you.